National Conference on AIDS and STIs in Africa, ICASA, is not just focusing on preventing AIDS, STIs and malaria. For the first time, Ebola, a disease that can be transmitted sexually, will also feature on the program.
Let's unite together. This is our opportunity.
But the major focus is on adolescents and curbing an alarming rise in HIV infections and AIDS deaths. UNICEF says it's had some success in reducing mother-to-child transmission.
More than 1.3 million new infections amongst children have been averted by PMTCT programs. The reality is that every hour, 25 children still acquire HIV.
The United Nations has set 2030 as the target year to eradicate AIDS, but much remains to be done. Only 52% of the people know their status, and risky behavior is increasing, especially in Western Central Africa.
We call for increased Africa's leadership to end AIDS by respecting the Abuja Declaration 2005 and boldly allocating at least 10% and over of the national budget for universal health coverage.
26 million people in Africa will now be eligible for antiretroviral medicines. And to treat all of these people means doubling the coverage of HIV testing, treatment and care in the next 5 years. It also means reaching key populations.
Some of these populations on the fringes remain vulnerable to the disease, and most of Africa, including Zimbabwe, have rejected calls to recognize LGBT rights.
We equally reject attempts to prescribe new rights that are contrary to our norms, values, traditions and beliefs.
But there is good news. Africa's spending on HIV has increased from $300 million 15 years ago to $22 billion. And for the first time this year, over half of that money was raised domestically.
Every 5 years, we have been able to double the number of people on treatment. If we manage to do it even one more time, we will be able to break the backbone of this epidemic and start thinking about ending AIDS as a public health threat.
The ICASA conference ends on Friday. Shingai Nyoka, SABC News, Harare, Zimbabwe.